Well, today is World Stroke Day, and this year's theme, Up Again After Stroke, is aimed at supporting the recovery of stroke survivors. 80 million people in the world have had a stroke and survived, while 50 million of them live with some form of permanent disability. Well, joining us now is Carica Combrink from the Angels Initiative. Carica, good morning, and thank you very much for coming through this morning. I guess stroke affects lots of people, but when I read a statement that came out, a press release that came out on World Stroke Day, I just couldn't believe the number of children who are now affected as well by stroke, because I grew up knowing in the old days that it's a disease for old people.
Yeah, so there's definitely a lot of children suffering strokes, but in the end, the disease is more prone to the elderly. In South Africa, it's a little bit younger, the age group for stroke patients compared to the first world countries. Unfortunately, because of all of our high risk factors within South Africa, including HIV, there is also children suffering strokes.
Okay, what's the demographic like in South Africa? I mean, you said younger than the rest of the world. How young?
So the majority of stroke patients that we see within South Africa is between 40 and 70, 75 years old, where in the first world countries like Europe and America, they see them much later, 70, 80-year-olds.
And among children, are we seeing a growing incidence? And what age groups would those children be, for instance?
The cases that has been reported to the Angels Initiative is not as much as the elderly patients, and it is also where there's a big family history and they're having prone blood difficulties and blood clotting factors. So there's separate incidents that's been reported to the Angels Initiative. But the biggest focus for us as the initiative and as the Heart and Stroke Foundation is definitely more the elderly patients.
Okay, you mentioned blood clotting. What are the major causes of strokes nowadays?
So there's different causes of stroke, one being modifiable and others being non-modifiable risk factors. So, of course, your non-modifiable risk factors will be your increasing age, your family history, as well as your gender. Believe it or not, there's more females suffering strokes compared to males. And then, of course, having a healthy lifestyle, not drinking too much, not smoking too much, getting your blood pressure under control, atrial fibrillation, which is an irregular heartbeat, making sure that you get to your doctor to get all of these risk factors under control is really important.
Okay, when somebody's getting a stroke, how do you know? I mean, how can you, like a family got a child who might be prone to it, what are the signs? What do you tell the people who come to the Angels Initiatives for support? How do you guide them?
Okay, so as part of the Angels Initiative, it is a very big focus of us to make sure that the public knows what a stroke is, because it is so time determined, and the sooner you get to a hospital, the better the outcome for the patients. So as the Angels Initiative, we're putting out an acronym called FAST to the public. So F is for your face. If you ask your patient or the public member to smile and there's one side drooping down, then it might be a stroke. A is for your arms. So if you ask the patient to keep both arms upright and one drifts down, or they're unable to pick on up in the first place, that might also be a stroke. And then speech is for a slurred or an impaired speech. So if you're really seeing that your family member or the member of the public is struggling to talk or understand you, that is also a sign of a stroke. And then T is just for time, because time is so essential in getting to a hospital.
So that's what FAST stands for. You hear all kinds of urban legends or myths, or I don't want to call it false information, but people speculate about it. Somebody said if you've got a terrible headache, you might be getting a stroke. Is that the case, from what you know, besides what you've told us?
Yes, so a headache is more prone to a bleeding stroke, or called a hemorrhagic stroke. So if you have a very severe headache that's a sudden onset, you must get to a hospital as soon as possible.
Yeah. So it seems from what you've said so far that stroke is like an onset of a stroke could be linked not just to hereditary factors, but mostly lifestyle.
Yes, for sure.
So if we manage our lifestyles better, what would those things that we need to do? I mean, you said earlier, we live in a very stress-prone environment currently.
Yes.
But within your control, what should you be doing to make sure that you are relaxed and calm at all times, really?
So the stats actually that you can prevent 80% of strokes from occurring if you have a healthier lifestyle. So smoking is the risk factor that actually increases your chances of having a stroke by the most. Some of the studies indicate even by 6 times. So definitely having a healthier lifestyle, getting some exercise within a day, about 30 minutes of walking, not too severe exercise. Don't drink too much. And then, of course, get yourself checked every 6 months to a year with your general practitioner.
And if you act fast, you don't have to die from a stroke.
Definitely.
Okay, thank you very much.
Thank you.
That's Carica Combrink from the Angels Initiative. As we've said, this today is marked worldwide as World Stroke Day. So take care and have a healthy lifestyle.